minute or two for public silence to the room. Did you say something to me?
No, it just said recording in progress.
Oh, fantastic.
It's giving you your disclaimer.
I appreciate that. Well, while we're getting settled here tonight, I want to welcome our audience here to Howard Hanson Hall at the Eastman School of Music in downtown Rochester, New York. And I also want to acknowledge that the land that the University of Rochester and the Eastman School is built upon is the Haudenosaunee land of the Seneca people. And we want to thank them for their stewardship of this land and the presence they have to this day here in Western New York. I'm Galen McCormick. I'm the program manager for Eastman Performing Arts Medicine. This is our final installment for Wellness at Eastman, and I saved the best for last. I really did. As many of us know here in this room, it's jury time here at the Eastman School of Music. Stress is high, practice numbers are off the charts, and I purposefully scheduled our two guests tonight to speak about caring for your voice, knowing that we've just come out of opera season, people are pretty taxed, and also that we've had a lot going on during the last 2 years of the pandemic, where a lot of us are meeting this way on Zoom. I know I personally have had a lot of vocal fry issues. And so thank you, you're gonna help me with that tonight.
Yeah.
Okay, so before we get into it, I just want to thank my leadership team from the Eastman School of Music. That's Jane Rossi and Donna Fox, and our leadership team at URMC, and that's Dr. Mark Taubman and Dr. Mike Rotundo. And without any further ado, Liane, Todd. Liane is an alumna of the Eastman School of Music, by the way.
Yes.
So I'm very excited for your presentation. Are you going to share screen to begin or talk a little?
Yeah,
first?
no, we'll just jump on in, kind of just start going because time's limited. And normally when we have these kinds of conversations, we do whole lectures. We have hours and hours. We're trying to distill down some good stuff for you guys into a short amount of time. So, hello, everybody. Hi back there. My name is Liane Grasso. I am a speech language pathologist who specializes in treating problems of the larynx and upper airway, and I have a particular interest in performing artists, musicians of different kinds, anybody who might be having trouble with this area. And with me today is
Todd Schneider. I'm one of the laryngologists at the URMC. So I treat disorders of the throat, but trained in ear, nose, and throat, but sort of narrowed things down to pretty much the voice and swallow and some airway things. So we work together every day, collaborating with various types of voice and throat patients.
exactly. And we're part of a larger team. We have 2 laryngologists who do treat performers. And I'm the primary speech pathologist, but we do have some other speech pathologists who do have performance backgrounds and are sensitive to performers' needs. So we are available for anybody who's having an issue. So let's talk a minute about a few scenarios. Maybe one of these applies to you. It's pretty common to have something feel a little off about your voice. It happens. Sometimes those things last a short amount of time. Sometimes those things drag out. But all of us use our voice daily. It is an extremely important part of our lives. In fact, it is part of the UN Declaration of Human Rights, Article 19, the right to communication. Now, it gets interpreted a lot as freedom of the media, but there is a component of it that addresses access. And access means your ability to actually express what you need to other people. Voice is the main way most humans on this earth do it. So imagine if you couldn't talk. How would you feel? How would you get stuff done? What negative impact might it have? You don't have to be a singer to feel a negative impact. We have patients who come in with these problems every day. And so our job is to help maintain people's right to communication. We're not just medical professionals. It's not all about the parts. It's about the human being behind it. So
voice disorders, even on a survey of all sorts of medical disorders, were found to have one of the highest impact on quality of life,
yes.
Compared to many of things that you'd think of as more impactful.
Absolutely, yeah. So real quickly, we're going to try to cover 3 basic things. We're going to do a super quick, how does your voice work? Very, very quick. What affects it and what you can do about it. That's more the meat of what we want to talk about today. So if you think about, those of you who are instrumentalists out there, if you think about the parts of your instrument, they match up with the human voice. We need some power source, that's our lungs. We need a vibratory source, that's our larynx, and we need something to shape that sound, That's everything above it. If there's a breakdown in any of these levels, it can affect your ability to use your voice. So as much as we talk about we're laryngeal specialists, the truth is other things going on with your body may negatively affect your voice. So that's why we do this kind of job. We're looking at the whole body, the whole person, and trying to figure out on what level is there trouble. And a breakdown anywhere affects the fidelity of the signal. So we have to think about the whole person and the whole system. But this is the business end that we're most interested in. So if you've never seen what a human larynx looks like, this is what we see every day at work. That's our view, right down your throat. And that's a pretty healthy larynx right there. You see those white little strips? Those are the vocal folds. We call them folds. They're commonly called cords, but technically they're folds of tissue, so vocal folds. And when you make sound, they vibrate. So again, this is a shot of what we see every day, at least on the left. But what we wanted to show you on the right there is kind of the other version of it. That's the cut view. So you can see that your vocal folds are actually touching, they're hitting. And musicians, this might speak to you. If you think about frequency, if you think about the pitch, and you think about the hertz of that pitch, whatever the hertz is the number of times per second your vocal folds hit. So if you speak at about, so for me, my speaking voice is somewhere around the 200-ish. So as I'm speaking to you, my vocal folds are impacting 200-ish times a second. If you're a singer, you're singing above the staff, maybe 700-800 times a second. That's a lot of wear and tear in the tissue. Kind of imagine doing that with your hands, right? How long would it be before your hands start to get kind of upset? So there is some limit to what we do. And if you're a person who uses your voice a lot, you have to think of yourself as an athlete. You really do. The definition applies. Strength, agility, and stamina. If you're a teacher, you have to project. That's strength. If you are a person in customer service, you have to talk all day. That's stamina. All right? It's not just about singers and using their voice in all kinds of interesting ways. If you are in music but thinking about doing something other than singing, you're thinking of teaching, you're thinking of being an administrator, you're thinking of being, some other aspect of the job, think about how much you need to talk. So the other point here to make, though, is just like an athlete, if you are using your voice a lot, if you are using your body a lot, it is more susceptible to injury. Just because you are pushing the boundaries. It's not a reflection of technique. It's not a reflection of good or bad choices. It is simply that there is less margin of error when we use the body at a higher level. And so certain professions can be more susceptible to injury.
And you only have so much money in the bank.
And
Your
you only
Boy
have so
Scholars.
much money in the bank, yeah.
And
both
just like your athlete there, Usain Bolt doesn't walk to the races,
Exactly,
he's
yeah.
conserving the steps that he takes, even to really do the thing when he needs to.
Absolutely. And so in some studies, they estimate 1 in 13 adults experiencing a voice problem annually. Now that includes just getting a cold. Okay, so if you think about that, yeah, a lot of people will have a voice disruption. Only a small percentage of those people, about 10%, will actually seek treatment. And so when they look at point prevalence based on insurance claims, it ends up being about 1% of the population in the United States has a voice disorder for which they seek treatment. So the good thing is it's actually not super common. We don't need to be super paranoid. But certain people are at higher risk. Older individuals, because as we age, our system is not as strong and efficient, so it has more tendency to glitch. Maybe that's the best way to
Susceptible
put it.
to error, just like your runner is going to be more susceptible to hurting themselves at age 60 than they are at age 20.
Exactly. And in the majority of the adult population, ages 19 to 60, The most common problem is actually a functional problem, meaning nothing is damaged, which is great. People come in, they're very, very concerned that something is permanently broken and it will never be fixed. Most of the time we can help, most of the time we can get people back to what they were doing, because what's wrong is just the parts have gotten a little out of whack, which is great. Teachers, based on studies, you know, we always have to say this, based on the studies, based on the population sampled, they are considered to be 2 to 3 times more at risk of an injury than other professions. They are the top profession for risk of injury. The particular teaching group that's most susceptible is actually physical education teachers, coaches. Think about it, right? Bad acoustics, yelling across fields, yelling over noise, and they have no training. People usually think it would be a choral conductor or something like that, but actually no, because there might be some training there with the voice that helps them protect themselves. All right, and if we talk about some college folks for a second. So in some studies, there have been shown elevated rates of vocal issues in early pre-service teachers, meaning that first year you go out and you start student teaching, because you go from one set of vocal demands to a different set of vocal demands. It's going from, if we want to use that athletic analogy, it's going from I'm walking most of the time to, okay, now I'm running a marathon every day. Your body is maybe not used to that shift. It needs some adjustment, it needs some conditioning. And so, you know, we want to support these early teachers wherever they're coming from. We're not just talking about elementary school teachers or music teachers, we're talking about all teachers. And the training in programs is pretty spotty. Some places have really, really great hearing health and vocal health programs, and others, they don't really have as much. So the support systems are not always out there for people. So piggybacking on what you were talking about, the vocal dollars, a good concept to think about is vocal dose. Vocal dose is a concept coined by Ingo Tietze, who is a voice researcher. He is still out there. He is at conferences. You can call him, you can email him. He loves to talk about voice. But in a nutshell, it's the idea that we only have so much wear and tear we can put on our voice. Think about it as money. I only got so much every day. And you choose how you spend it. So how you want to spend it, right? Do you want to spend it using your voice really loud? Because the louder you are, the more tired your voice gets. There's only so much we can sing. We know this. If we sing all of our high repertoire all the time, we got to take more of a break, because the more frequency impacts we get, higher frequencies, more tired. So we have to think about those variables and think about the end game. Can I make it to the end of the day? Will I make it to the end of the day? What happens if I don't make it to the end of the day?
I'm between paychecks and I don't know if I'm going to make it through. You know, it's definitely cumulative.
And so that first stage is just vocal fatigue. Vocal fatigue is my voice feels tired, you know, dragged down, maybe a little bit uncomfortable, but you go to bed, it feels better the next day. You're working within your limits. Maybe you just pushed it, but you're still within your limits. That's okay. If we extend that, we start borrowing on the next day, if you want to use that analogy, now we're in the realm of phonal trauma. Now, something about the way your vocal folds are vibrating now, those tissues are damaged. It's a warning shot. Doesn't mean something horrible yet, but something about those is just not as good as it was. And now you're feeling your voice is worse the next day. Maybe it lasts a day, maybe it lasts all week, depends. If that phonal trauma continues, if we push it too far, we end up with an injury. We end up with an actual problem. So this is what one of those could look like on the vocal cords. Those vocal cords are not pretty and white like that other picture. And they have some little bumps. Now they vibrate differently. And now you need help.
And those are the in the analogy you're using before, it's just like if I was doing this all day long, I'd eventually develop a callus or a sore or a blister. And I would, if somebody could come and tell me, hey, maybe you should just like clap like this or not hit those surfaces so hard, then you have less risk of having a callus. If you moisturize your hands, all the sorts of good techniques to prevent injury can keep you out of the operating room and I love operating on vocal cords, but I don't like doing it when it's not the right thing.
Yeah.
Or when it could be avoided.
Laryngologists are surgeons who don't want to do surgery.
It's true, it's true.
We avoid it at all costs. So what are some of the factors that go into this? How you use your voice, we just talked about that vocal dose. How you're using it. Are you yelling over noise all day? Are you speaking, in a comfortable manner across a desk? Are you on Zoom all day? Are you giving examples of different singing out of your range because you're a choral director and you're trying to give examples for the women, but you're a man, trying to work all that out. All of that can have a factor. Your general health plays a huge piece. Are you getting enough sleep? Are you eating well? College students, please think about
You're not doing
this.
any of that from my
No,
experience.
of course not.
You're indestructible.
But also along that, other health concerns. What might be undermining your voice? Sometimes it's obvious, allergies, sometimes it's not. Sometimes people come in with some interesting other things going on that are actually affecting their voice. What's the environment? We're in a nice little hall today. I can just speak. This feels comfortable. It's not too big. If you put me on the stage in Kodak Hall and asked me to do the same thing and people were way in the back, I'm not going to make it. Not without a microphone, right? So what are the circumstances you're communicating in? Is there background noise? Are you trying to talk over noise? Are you a server in a restaurant? Are you a kindergarten teacher, right? All of those things. And now we have some new challenges in the age of COVID. We have masks. We have way too much time on Zoom. Hi, everybody. Yeah, we communicate differently through teleconferencing. There are research studies, mostly out of occupational health, I found, that talk about the real Zoom fatigue effect. There is a perception of distance. I'm looking at this little camera here, but my brain thinks y'all are way, 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 way far away. So I want to talk louder just because I am not getting the normal feedback. I have to remind myself I don't need to do that.
Yeah.
Same with the mask. I don't need to breathe harder. I don't need to be louder, even though this thing is on my face. It's not really making a difference. Yet my brain goes, it is. So we have to think of all these things. And we have had anecdotally, but actually the research is starting to support this. There's an uptick in voice issues since the pandemic started because we're changing our communication style.
And it changes how you are delivering your voice to people when you are sitting in front of a computer. If you're not using good ergonomics, if you're doing other stuff at the same time, you're playing with your phone and your neck is all twisted up, then we get into these other injury sort of things, or you're just speaking right to that monitor and you just feel like you have to push, and you end up with feeling more fatigued talking through Zoom than you do.
Exactly.
I could give all my Zoom meetings in a room like this where it like feels good to project.
Yeah.
That'd be great,
Yeah,
but
space
otherwise
is up.
I'm sitting in a cubicle and 70 degrees and fluorescent. It's not like this at all.
So this slide, I call this the Captain Obvious slide. We all know this on some level, really. If you get good sleep, if you keep yourself healthy, eat well, avoid things that bother your voice, stay well hydrated, that supports good vocal health. If the vocal folds are healthy, they vibrate with less effort and it won't spend as many of your vocal dollars.
And I'd add to that as a husband of a psychiatrist that mentally, where are you at? And, where's your anxiety? Where's your, because those all feed into these things.
Yes.
And the voice and the throat is extremely emotional. This is what makes us human along with our brain. And those emotions feed right into the vocal cords and our vocal folds. And can make a big impact.
Yeah.
And those can fly under the radar for years and really, crop up as big issues down the road if they're not addressed.
And we see them in our clinic. Think about your communication environment. Is it set up to help you? Can you change it? Can you optimize it? We need to use amplification if necessary. We are huge advocates for teachers in all settings to use amplification, even if they feel they generally don't need it. Once we get somebody using amplification, it's one of those I didn't know what I was missing kind of situations. So please use amplification if you have it. Don't overwork yourself if you don't have to.
It's kind of like a coupon for your vocal dollars, because it's letting them extend even longer. Because you know, that vocal fatigue story of the teacher that's like, oh, I did great until it was spring break, and then yeah, I'd lose my voice, and then after spring break I'd do better. You know, those teachers are extending their ability to use their voice with less vocal fatigue, and you know, going longer without having trouble.
Yep. Having good setups for Zoom conferencing. Thank you, Galen. This is
Yeah.
wonderful. I don't have to work very hard.
Not at all.
I'm talking very naturally here. I don't feel like I have to do anything different. Thinking of those things, and don't fight the mask. Check in with yourself every once in a while. Are you mouth breathing behind your mask and then you don't realize it? Are you feeling yourself kind of heaving when you're talking, like you don't have enough breath to talk on? Chances are you're fighting the resistance of the mask. There are some things you can do, and I'll get to that in a second, to kind of check yourself and help your system kind of down keel a little bit if you're feeling yourself fighting it. Now we're wearing these nice thin surgical style ones. They're easier to breathe in. If we're in our N95s, that's a different story. If we're wearing other things, but we've been doing it all year. We're figuring it out. My voice is not trash, so we're good.
Well, and experimenting with different masks and spacers and that sort of thing can be helpful, because you can even be having an allergic reaction to a mask. I saw that a lot, where people are getting
Yeah.
stuffy nose and then were
That's
not
true.
projecting well. So
Yeah.
it was about changing the style of masks.
Exactly. And think about your habits. Are you giving yourself time off from talking? Or are you loading all of your talking engagements? Can you spread them apart? Can you change a little bit about how you're talking? So we're trying to get a bunch of information in here, and maybe we're getting a little bit fast, but the studies on voice function show that if you think about slowing down, speaking more clearly, you give yourself time to breathe. Your voice doesn't work as hard, you don't build up tension. So if you think a little bit like you're giving a presentation, it actually can help your voice work a little bit easier. Anytime you feel some irritation down here, fight the urge to clear it. If you have to, you got a cold, you got clear stuff, okay, fine. But a lot of times what we feel here is just irritation. People will get into habits of throat clearing. It's just like scratching at an irritated itch. Doesn't make it feel any better, it just makes it worse over time, okay? So if you catch yourself clearing your throat a lot, try to take some sips of water. Try to just swallow, sometimes that helps. Just relax and breathe. Sometimes we can just say, yeah, I feel that, but I'm okay. I don't have to do anything about it.
We can gross you out by telling you make 1.5 liters of mucus and saliva a day that you just swallow, and you should just swallow it. You don't need to fight it.
There you go.
It's meant to hydrate.
So a couple of things that you guys could take today out into the world and try to see if it helps your voice a little bit. If you give yourself time to breathe, you have more power. It is a very powerful little tool. I would say that 90% of my voice patients, the primary thing is they're not relaxed and breathing. Something in their system has gotten tight. So if you can get them breathing and using that air, your voice will be more efficient. So give yourself a little space, a little time, take a breath, remind yourself, put a little note on the corner of your computer, breathe. It does work. Think about what your voice feels like. Do you feel like your voice is kind of buzzing up in your face? Do you feel like it's stuck in your throat? Yes, we make the sound down here, but the more we feel it here, that's actually the product of a lot of tension in the system, changing the resonance so that it's really kind of stuck.
So it's feeling like you're in your lower part.
Yes.
Yeah. That's it.
Right.
If you hear that, just breathe.
Yes, take a second. Chances are you can put it right back up there. And some things you can do for little vocal breaks. Some of you may have heard of these things if there's singers listening to this. Straphonation, semi-occluded vocal tract exercises if you want to be super technical. So if you take a straw, take a cup of water, make some sound, blow some bubbles, even if you just have the straw and you buzz on it, if you do that for a few minutes, it changes the air pressures in your throat to help the system relax. It can get a little tension out, it can refresh your voice. It doesn't have to be done for a long period of time. 3 minutes is about the optimal sweet spot. If you don't have a straw, if you don't want to use a straw, lip trills, raspberries, even humming, if you're relaxed when you do it, can give a similar effect. So give yourself a little time to just relax, breathe, buzz your face, and it can actually help your voice a little bit. And relax throat breathing. So if you're into any kind of meditation, mindfulness, yoga, and if you've ever been told breathe in through the nose, breathe out through the mouth, there's a physiological reason why that's good on several levels. But for us, it creates the similar back pressure. It can help your throat relax. So even breathing like that can help things just break a little bit.
And I think being mindful of your tension, it's very easy if you're sitting at the computer, or you're driving, or you're doing something and you're tensing your jaw. It's like checking in with that jaw, checking in with that throat, relaxing your shoulders. Because if you're sitting here, just like if I was trying to play the piano and I kept everything very straight, I would not be as good as I kind of checked in with my tension and made sure you were nice and relaxed.
So if you are concerned about your voice, if something happens and you wonder, am I just being a little over concerned, or is it time to see a doctor? There are some guidelines for this.
Yeah, anytime there's a persistent change, and I guess I would back up a little bit, where a lot of you guys are going to be in the category of professional voice users, and I would, if you look at the sort of guidelines, I think that you jump the line a little bit, especially the singers here, that most good voice centers, and us especially, is we're going to get you in. Use the magic word singer, make sure you can give a little pushback if you get pushback, which you shouldn't, but using the magic word singer, we want to see these things early, just like we would want to see, any sort of disease, in an early stage, because it's easier to treat than if this has been let go for a long period of time. If the voice is persistent, more than 2 weeks for your standard, voice user, it should be seen. Most of the sort of post-illness kind of voice changes are going to resolve in 2 weeks. But again, if you're your whole livelihood and career revolves around the clarity of your voice, then don't wait the 2 weeks. Come in and let us know. But sudden changes, you're going for it, and the voice changes and it does not come back, you need to come see us, and you got to shut that down. Complete voice rest. Any pain, sudden change in pain, anything that feels like, tearing, ripping, straining, pressure, all that stuff. If you feel it, trust it, you know your body better than we will, but that should get checked out. And we can bring you in and take a look at your throat in various ways, and take some pretty pictures like the ones we were looking at earlier, and just make sure we're in an okay place. Most of the time, it's not anything. It actually looks pretty good, and it's more of a, relax, breathe. And but it's for the 1% of times when it is, we need to get you, we need to see you. So,
and seeing somebody like Dr. Schneider here, who has the right equipment to evaluate it, who has the expertise. There are voice teams in just about every major city in the country, so wherever you land, wherever you are, you can generally find some kind of voice specialty team to help you. All right. Are there any online questions or anything anybody wants to ask?
Just to
Since we have a couple of moments. And while they're looking at that, this meme is absolutely true. We cannot turn it off. We hear people's voices all day. We hear differences in them. They could be distracting if we hear something really unique or interesting. It's just our lives.
Would it make you turn your head in the grocery store is usually what I tell. It's like your voice wouldn't make me turn my head in a grocery store, and that's usually a compliment that you're not too bad about.
And also, just in case you're looking for a little more information, if you take a screenshot of this or take a quick picture of your phone, you can find us at the Voice Center. And also there are some really good information guides out there put out by some student associations that you can check.
We do have one of our listeners, viewers, I guess, is asking, do you have any advice on post-COVID upper respiratory system recovery?
Yeah, so we are learning as we go. But
building the airplane as we're flying.
exactly. But generally what we're seeing are people who are deconditioned. They took a hit and they need to get back into conditioning their body at a pace that their body can do it. We do respiratory training with patients like that. So going back to our original conversation, it's not all about what's here. We do work on lung capacity with patients and coordination and strength and stamina.
And that got like a sexy review in the lay press a little while ago. Where was it that was doing some of the respiratory training with opera singers?
Oh, that was over in
COVID, yeah, like
London.
Somewhere
English
in the
National
UK.
Opera.
Yeah. So it's all over the place for a little while.
So, so if you're a musician, you got to kind of tap into what you know, but you may need to take it to the next level. There are resistance trainers. You can get guidance from speech pathologists or from a respiratory therapist, or if you work with a pulmonologist, well, there's a little overlap there. Sometimes it's just physical conditioning. You got to get yourself moving again. You've got to get yourself exercising again to build that stamina. In a small percentage of patients, there have been issues with the larynx itself. So if it's something about that vocal quality or stamina is not there, see somebody, because we might need to, check and see, did something get too weak? Did something get damaged? That's extremely rare. That's really only the intubated patients that were having that happen. It's not just from people who had it and didn't need, an intubation tube.
But with any virus, there's always a chance at some sort of injury to the fine motor nerves in the voice box, and that has existed well beyond COVID. Has there been exactly COVID-related vocal fold paralysis? It's not necessarily proven, but it's I guess it's just, if you are sick and you're recovering and you're not there, don't push yourself. I guess I'd rather we see, especially if you have that, voice demand and it's your whole livelihood or your whole, future plans. Earlier is probably better, and we can rebuild those blocks or give you the tools you need.
So we have another person who is talking a lot as an elementary teacher, has been a vocalist and not practicing singing right now. And they said they've lost their vocal placement, and then put in parentheses mask. So I think that's not a term I'm aware of as a non-vocalist, but
yeah, I can interpret that. Yes. I speak singer. Yeah, so that goes, I speak singer, teacher, I speak a few languages. That speaks to this idea of forward resonance, I think. Where do we feel our voice? So usually if people feel they've lost that, something is off in the system. And it's usually something about air, something about tension, or a little of both. And trying some of these techniques that relax the system, trying some of these things that promote a feeling of forward resonance, buzzing, humming, zzz, all those things. If you can kind of find that feeling, get a little relaxation and find it, you might be able to keep it there again. If you're having a hard time, you might need a little help.
And I love as an instrumentalist and non-vocalist,
yes,
I love my singers, and but you tend to be, when I meet with you a lot of the times, it's like, I know this, and you spend so much time thinking about how you're creating your singing voice that you may not have. Some of these things can apply very much to the speaking voice, but we're sort of like thinking in the speaking voice realm, how do we apply those things? And sometimes it's a quick fix, because you know it, but how to apply it is just a little twist on the information that can be really helpful. And
exactly.
with teachers all the time, and it just should be in the curriculum.
And the thing I always remind singers that I work with is that they're used to working from a healthy base. They know what habilitation is. They know what taking things farther and more technical is, but they haven't worked below that level. And sometimes we have to back it up in a way that they just don't understand because they've never had to. That's my job. That's what I do. How to really actually back it up to a more basic functional level in the body. And so sometimes just having a few tools from that level gets people back on track. So that's the rehabilitation. That's the side of the fence I live on much more solidly these days versus teaching voice, teaching skills on healthy singers. I used to do that. I still do that a little bit, but I'm really on the other side now. Yeah.
I could have written this one, but thank you to the person who wrote this one. Do you have any advice for aging voice?
Yes.
Hormonal changes.
Yes.
Oh, thank you. I need to answer this one.
So the first thing is you have to have a little grace with yourself to understand that time marches on. We can't fight it. We have to adjust. We have to roll. Okay. Things are going to change, but I'm going to go back to our athletic analogy. Okay. So as the voice is changing, as we age, it tends to be, yes, there are some hormones involved, there are some other factors, but it tends to be mostly related to normal atrophy and dystrophy and apoptosis, very fancy terms, but what they mean is our body is slowly not working as well, okay? And we've learned to function on a certain level, and now the equipment's changing. So what do? One of the big ones is keep practicing. Keep using your voice, keep using it in a healthy manner. We have really good studies that show that maintaining good voice use keeps people with healthier voices longer. They use these with Parkinson's patients now. There's music-based techniques with Parkinson's patients because they work, they get the voice stronger. If something feels significantly off and you can't correct it, go check in with your doctor. See if there's something that can be helped in the background. But really what it boils down to is having those resources to help you readjust your path, because it may be that we can recondition and get you back to what you did. It may be that you have to approach it a little differently. It's not going to be the same anymore. It can be good, it can work similar, but it's not going to be the same. We don't always intrinsically have those tools. That's why it's a good idea to come back to teachers, keep working with voice instructors. If you need a little more help, talk to somebody like me, because you have to adjust. But aging is not the kiss of death. It's not. We have a lot we can do about it.
Specifically hormonal changes and just the overall sort of effects throughout the whole body in menopause affect the vocal folds.
Yep.
And hydration being one of them, and just the overall sort of like resilience and plumpness of the vocal folds tends to change. And so I always, it's a word of warning for hormone replacement therapy. There's so many warnings for that anyway, but especially if they talk about androgens or male hormones in a female for osteoporosis, that can drop your pitch, and it can be irreversible. So that is something to, if they say, hey, we're thinking about doing this for your osteoporosis, that if you were any sort of professional voice user, say no. Unless you want that. I mean, that would be cool.
Sometimes we have to.
But that is something to be aware of, that there are a lot of hormonal changes and estrogen receptors on the voice box.
There you go.
Really appreciate that. We have one more, which is about mold exposure. Is there a treatment for that, or some kind of recovery for that?
So, the main thing is always, if there's true, like if you are in an environment where something you are truly allergic to, it obviously we have to control the environment. You have to get away from that thing. But if there are symptoms that are persisting, frequently they fall into our functional bucket. The body got used to working differently when it had to, because it was trying to adjust. And now that that particular irritant is technically gone, it's like the body is just stuck. It just wants to keep doing what it used to do. And so frequently therapy techniques that I work with patients can help get the body back into functioning in its normal capacity. It's about sort of learning what those signals are and helping your body respond differently. So there are things that can be done for that. It's very individual to the person.
The cynical version of this is that there are folks that will have some technique or functional problems, and they sometimes the like reasoning when somebody isn't sophisticated with voice. If you're seeing a regular ENT or maybe a primary care physician, and good, they'll say, oh, it's probably your mold in your apartment, when it could be, and so sometimes that will get the blame. But if you go for like allergy testing and they don't find it, or they do mold testing, it may be that you are reacting to some of the things in the environment, not necessarily a true allergy, but again, you're
sensitivity,
exactly,
irritation,
and that is very true. That we're not discounting that feeling you're feeling, but if they tell you you're not allergic to mold, there's mold, something doesn't feel right with that environment, that may be where working on some technique or some desensitization, things like that can be helpful.
This is fantastic. My last question is for you directly, Liane, if you don't mind. As an Eastman artist, I'm wondering how you became interested in going to this functional medical side. What got you started with that?
So I was always a person who was more interested in the how something happened. So, I'm like the person who wanted to be under the hood of the car rather than driving the car. So I enjoyed performing. I enjoyed the artistry. I enjoyed working with other people, but I was always like, but how can you do that? And you do the same thing and it hurts you, but you're fine. So what are you doing differently? How are you doing it? What's the specific thing? And so I was always spending a lot of time looking at the scientific material. And it should have been a warning sign in grad school. When I was at grad school from music at Florida State, that I spent more time in the science library than I spent in the music library. And my brain just followed that path and I met speech pathologists who work with singers, and I went, that's my job. That's it. I get to be a medical provider and science-minded, but I still get some artistry. I still get to work with some finesse. I get to flex all those skills. This is great. This is my job.
And even in our field, there is that creative component that
Yes.
there is so much unknown, and there's so much like emotional like, it's not like there's a broken bone, I'm gonna fix it. It's very like,
Yeah.
you know, that you get to scratch that creative bone,
Yeah.
I think.
Exactly. Yeah, I'm constantly listening. I said it. I'm constantly listening and analyzing signal all the time. So it served me well. It served me well. My music background really helped me help my patients more, I think.
That is fantastic. May I join you on Zoom?
Yes,
for a moment?
please.
I think we have answered all of the middle and everything.
Yes, you get the middle.
Oh
You
my
get the
goodness. I
business
think we've
side.
answered all the online questions. I dropped into the chat Eastman Performing Arts Medicine's website. You can get connected with our providers that way. You can also use their QR code that's up on the screen or on your screen if you're in Zoom. And I just want to say, one of the reasons you guys are on our provider list is because you have the specialty, and that all the providers that show up for Eastman Performing Arts Medicine absolutely understand performing arts. And that's why they've all decided to come in and join this program, so that they can see artists like you all. And by artist, I also mean teachers, and I mean teachers who are speaking and having this issue. Please do call through that hotline to get seen quickly. I can't thank you enough. This has
You're
been
so
really
welcome.
helpful. I've really
Good, I'm
enjoyed
glad.
it. And as I always am, when I talk to any vocalist, I'm now super self-conscious.
No,
That's all right. I will get
Don't
over
feel that way.
myself. I will get over myself. So I'm really excited that we were able to close the series with this. And I hope that our vocalists, professionals, students, teachers who are watching tonight, I hope that you've gotten things out of this. I'm going to be sending out a survey to everyone who has signed up for this throughout the year, just to hear, have you enjoyed this? And I'm already planning next year, really excited about some of the people who are saying they're going to come Zoom with us from other countries, some of them
Nice.
who are around the country. So yeah, it's been a great year of learning for all of us here. And I so appreciate your support. So thank you, all of you who are here tonight. Thank you, those of you on Zoom. We'll see you again in September, but meanwhile, keep washing those hands and stay safe.
Yep.
All right, thanks everyone. Have a good night.